This is my client Ian, and he had right peroneal tendon surgery about 3 weeks ago. So that's why you see the ace wrapping on his foot. He has a history of scoliosis. So when were you diagnosed with scoliosis?
About 12 years old.
Okay, alrighty. And so you've been aware of some normal for you, asymmetry in your body.
Yes.
Did that impair function?
No.
No, you were very athletic.
Yes.
You're wearing a 2016 Boston Marathon shirt.
Yes.
Did you run it?
Yes.
Very good. So you're a triathlete?
Yes.
Okay, good, good. Now, we treated you yesterday for a downslip of the ilium, and you're much improved with that. But after doing that, you still have some residual asymmetries of the pelvis that you're aware of when you're sitting. Is that your norm to feel asymmetrical?
Yes, in recent years, yes.
Okay.
That's the norm.
Okay. So having looked at your pelvis, I believe that your pelvis has developed asymmetrically from one side to the other, which doesn't seem to bother when you're standing or walking, but once you sit down, the chair is trying to force you into symmetry. And hence some perhaps discomfort, mild, you might even be unaware of it. We find that when we get people sitting more, when we alter the seating surface, they notice that they're more comfortable. They may not complain of pain per se, but
it's not so much pain in the sit bones or in the hips, it's stress and strain on the lower back and the upper back on the side where the unevenness is occurring. So you're taking more strain on the side of the lower where it's uneven, if you like. And so
very good.
anytime you level it out, you take a lot of strain off the back, the lower and middle and upper back.
Very good. And so you have discomfort when you're sitting.
Yes.
And because of your occupation, you're an engineer, but you're a computer engineer?
Yes.
Yes. So you have to spend time sitting.
Mm-hmm.
And you have to go to meetings, right? You have to meet with clients, and that's sitting down, right?
Mm-hmm.
Okay. So we already played with props in different places. We had you sit on a prop under one sit bone, and that seemed promising until we then tried a prop under your hip, under the trochanter, and that was clear that that was the most effective intervention. We even tried a prop behind you on one side of your pelvis and the other side, and so on. And we could even try, sitting, what I call a sitting heel lift. And in my truck, I have developmental asymmetry in my hips. And so under the floor mat, I have a piece of cork taped on it. So when I'm driving my truck, I'm sitting, the surface of the floor straightens me out a bit. Mm-hmm. It matches my asymmetry of my body. Right. So anyway, this is a very simple $10 item that we make, and we have to meticulously dip this foam in a rubber dip and let it drip and drip and drip, and it's time consuming. Perhaps $10 is too cheap, but anyway, it's a very comfortable, long-lasting device. What happens when you put this under the left hip, just outside of the pocket? So it's under the trochanter.
So that actually makes the sitting position worse. It basically I guess extenuates the problem.
Yeah.
Causing even more pressure and pain on the
right side. Good. So put it under the right side. And you can see it's right under the front pocket. And you can put it back a little bit. So it should go outside the pocket. Take it back 1 more inch. Good. So it's right outside the inferior entry of the pocket. Alrighty? So tell me what that does for you.
So that essentially it evens the distribution of weight out when I'm sitting. So before you kind of sit more there, you kind of slant more to the right, and with this it's kind of evened everything out. So there's an even weight distribution left to right. There's an even weight distribution on each of the sit bones, and I sit a lot straighter.
Very good. So it's a simple $10 intervention. Mm-hmm. As long as you don't lose it, it's cheap. if you start losing them, you can tape a string to it and then a little carabiner and hook it to your pocket loop so you don't leave it in a restaurant or something like that. So that's phase 2. We'll have to develop that part. Anyway, for now, it's just a $10 cheapy thing you put under the trochanter, and for some people makes a world of difference. So I thank you, and I'll stop filming.